All right, my name is Gabriel Peña. I'm the chair for the respiratory program. And I wanted to start by saying, did you guys know about respiratory therapy before the video? Okay, so I mentioned before, like, some of you have heard about respiratory therapy, some of you haven't. What do we need to be alive right now in this moment, besides Starbucks? You can speak up. I mean, it's not a test. If you're thinking about CPR, what do you need to be alive? Heart. That's a big hint. A heart. You need to have a heartbeat, right? What else? Oxygen. Yeah. Okay, so there's 4 critical life functions. The first one is ventilation, and that's the movement of air in and out of the lungs. That's what breathing is. Second one is circulation. The second one, I'm sorry, is oxygenation. We have to have oxygen in that air. The third one is circulation, and the fourth one is perfusion of blood pressure. As respiratory therapists, we deal with the first 3. So for example, if someone is in pain, somebody needs to go to the restroom, and somebody's thirsty, can you wait for those things? Nobody can. I mean, it depends on the situation. But if somebody cannot breathe, how long can you last without breathing? Like if you're going swimming, how long can you stay underwater? Not that long, right? I mean, you cannot stay like 30 minutes or 10 minutes, 20 minutes, no. Alrighty, so I don't think it's working, but sometimes it takes a little bit. This is a demo for, well, actually it's called Poll Everywhere, where you can actually put on the information. You mentioned oxygen, and it's going right now. If you have your cell phone with you and you can use it, you're gonna text a message to 22333, and you're gonna type 1098.16.2 and put a space. You can do it right now, and put how much percentage of oxygen do you think we have in the room right now? You wanna do that if you have your phones? If you don't have it, you can say it. But you're gonna text to the number 22333, and the text message should say 1098162 space, and then put the percentage. You can put like whatever percentage you think. Just pretend you're gonna win a car if you get it right. Pretend, right? I don't have a. And we'll just take a few minutes to. So I know people are texting, so I'm just gonna wait a little bit. We should see the results. Has anybody sent it already? The phone number, like if the person that you're gonna text will be like 22333, and then as a text message, instead of putting hi, you put 1098162, then space, and then the percentage. So somebody already put like 70%, and now the whole class is gonna put 70. And we'll just wait a few minutes just to give anybody a chance to answer. Somebody else put 70%. They put it sideways. No, not 90%.
What did you do? You said we put a space and then.
You type the phone number is 22333, and then the comment is gonna be the number that's on top, 109, space, and then the percentage. So we have 30. 80. Okay, well that's a pretty good representation. So nobody really knows or have a clue, right? Alrighty. We actually have 21% oxygen in the room, and that's outside. And now it's gonna be there, right?
100%.
So somebody has. That's good for the exam to have 100%, but not oxygen. So that's very important because we rely on that. So we actually have 21%. Now I'm gonna show you. How did that get there? No, I'm joking. I'm gonna show you a picture of this girl. Do you guys think she's pretty? In general? You know, guys? Or, you know. Okay, now one of the things that we do as therapists is that we're gonna be assessing. You know, so if we go to the hospital, we cannot really say, Yeah, the patient looks sick because the patient, I mean, they're at the hospitals because they're sick, you know, they're all gonna look sick. So, can we make her prettier? I know girls are really good at critiquing other girls. Can we make her prettier? Makeup, yeah. I mean, she can use lipstick, eyeshadow, maybe, you know. What about her hair? What about her hair? Is it okay like that?
No.
Is it better loose or?
Yes.
So then, we're not gonna do the other question, but it was the things that you answered, makeup and things like that. And this is a before and after picture. So, I mean, she was already pretty to begin with, and the makeup and everything enhances that. So, when we are assessing our patients, we want to make sure, like, are they having trouble breathing? Are they using their accessory muscles? Do they look blue? They're cyanotic and things like that. This is a class of 2012, and they're all working right now, and they're all respiratory therapists. The program that we have is an associate's degree. It's a 2 years, so we have first years, and then we have second years, and then they're supposed to graduate, and I just kind of put the information there. If you want to contact me, my room number is in 423, and I have an open door policy. My office hours this semester is from 4 to 8 on Mondays. You can come and talk to me if you have questions. And I just wanted to share this quote that I like. It reads, "I'm a success today because I have a friend who believed in me, and I didn't have the heart to let him down." And sometimes that's what we need. Sometimes we're here because we want to have a better education, a better job, but we also have someone at home that believes in you. It might be your children, it might be your siblings, it might be your parents. And sometimes when you get a degree and you have a better job, you're going to motivate people like your neighbors, your family, to get an education, right? So if you don't believe in yourself, if you have someone that believes in you, you don't want to let them down. You know? Our mission, or our vision, actually, for Respiratory is a better quality of life for our community through respiratory therapy education. And I'm just kind of throwing this, I'm going to talk about respiratory, promise. But we do a lot of community service with the Respiratory Club and also with the program itself. We do asthma education. We go to the elementary schools and we educate children on triggers and how to take their medication properly. And you might not know this, but a lot of children, they don't take their medications, or they don't tell an adult when they're feeling sick. And there's been incidents that people die because they don't tell that they have an emergency. Because you know how children are, like they don't want to go to the restroom because they're afraid to ask, and they pee on their pants. So if they're having an emergency, they're afraid they're going to get in trouble, so they don't let the teacher know, and they don't go to the nurse. And this is basically what I talked about. And I just want to let you guys know that we're in an advanced level respiratory therapy program. If you compare it to nursing, it's kind of like doing the LVN and the RN together. We prepare you for the registry, but you have to take your certification first, and then pass that board exam, and then take the registry. When you finish, you become a registered respiratory therapy. We don't have an assistant program. They're saying because of the demands, there might be a need for a respiratory therapy assistant program in the future. And they're trying to push the registry to a bachelor's program. And right now, in the last conference that I attended, they're also talking about doing an advanced level, like a physician assistant or nurse practitioner program for respiratory, which is going to be a respiratory practitioner program, where you go and take your master's and you be like a doctor. Well, you're going to be working under a doctor, but you're going to be acting as a doctor. You're going to be prescribing, you're going to be working in the clinics, going to the hospitals, making changes on the vents and things like that. And I know I'm just kind of like throwing information at you, and then everything's going to tie together right now. Basically, the program, all the information is brand new. It's very different. Like, for example, if you're taking algebra, you learn the information from algebra, then you take calculus, and you don't really use algebra for calculus. You might need it a little bit. Well, these programs, you have to have a foundation. So if you're cramming the day before the exam, you might do good in the exam, but then 3 weeks later, you're gonna have to learn that information. So I don't recommend you to memorize things. And basically you learn the information in lecture, then you're gonna practice in lab on the procedures, and then you get to go to the hospital and actually work with patients and do those procedures in the hospital setting. Just want to throw out in there that we are accredited by COARC, which means that they come and check to make sure that we're doing the same things, you know, like we have the same standards in the nation. So what is a respiratory therapist? Even though I look like I just graduated from high school, it wasn't a joke, but I have 14 years experience working with premature babies. And these babies are the size of my hand. Like for example, the head is right here and the feet are right there. And they're very fragile and they're humans, you know. And it's not like you can mess up and tell the mother, you know what, I'm sorry I messed up, but I have this kid that is 6 years old. He already talks, he's already potty trained, he goes to school. Like we cannot do that. It's not like fixing a car where you mess up and you can just have an insurance and pay for a new car and you know, you get the new car. So it's a lot of responsibility. And one of the duties that I had to do is to make sure the baby's breathing okay. And if the baby's not breathing, we're gonna put a tube down the throat and we're gonna put him on a ventilator and we're gonna measure the pressures and how much volume the baby's gonna have, how much oxygen the baby's gonna have. We're gonna be drawing blood and analyzing that oxygen to make sure it's appropriate because room air is 21%, so we can go up to 100% in the hospital. And oxygen is a drug. If we give them more, it's bad for them too. So we're gonna be monitoring those things. But in reality, we work in different areas of the hospital. We can work in ER. In ER, like for example, if there's a car accident, you're gonna be assessing. You're gonna be in that code blue, and actually you're gonna get help. But we're gonna clear the airway to make sure they're breathing okay. If they're not breathing okay, we're gonna be bagging. We're gonna breathe for them. We're gonna provide oxygen up to 100%. If the heart is not beating, we're gonna provide the CPR. We're gonna draw blood and analyze the blood gases, and we're gonna transfer that patient to the adult critical care unit. So we work in PD ICU, adult ICU, ER, floor therapy. We work in doctor's offices doing pulmonary function tests for disabilities. We do sleep studies and we don't get to sleep. We watch patients sleep to see if they're not having sleep apnea. So there's different areas where we can work, doing patient asthma education, COPD education. And so for example, one of the things that I mentioned earlier was that for example, if you're thirsty, hungry, all those things you can wait, but when you cannot breathe, you become a hero to that patient, because if you're there and you're giving them a treatment or you're giving them oxygen or you put them in a machine that would help them breathe, that's, I don't know if anybody of you had an experience where you cannot breathe, like if you have an asthma attack or choking experience, that's not a happy experience. But when you have someone that helped you, that person becomes a hero for you. This is a picture of a premature baby, because sometimes it's hard for us to tell you what it is, but this is a very fragile baby, and it's like a different world in there. I'm not gonna play it because I don't think I have enough time, but I have a video of a premature baby and all the problems that, well, not problems, but all the stress that the family has to deal with, the parents. So I'll share that video in case you are interested. The degree plan, prerequisites. The prerequisites is anatomy, 1 and 2. You have to have college algebra, composition, your humanities and speech. You have to have A's and B's on those prerequisites. You have to have a 3.0 GPA. And once you have that criteria, then what we do is we do an interview. And based on the interview, we decide who's going to get into the program. Do you guys know what selective admission is? You heard about that? No? It's just worded a little bit different. Basically, by our accreditation, we can only take about, for example, respiratory, we can only take 30 students per year. I'm not allowed to have more. So if 100 people are interested in the program, I have to select which students are going to get into the program. So that's the process that we do. We look at your grades. We look that you have all your prerequisites. If you take in college success and you get an A, you get 2 points. If you have a B, you get 1 point. We look at your experience, like if you have, if you volunteer in the hospital, if you work in a hospital before, then you have some experience. Because we can get a student that has a 4.0 GPA, and he or she might faint when they see blood, and that's not gonna be good. But when you're exposed to the hospital, you kind of know what you're getting into before. The interview process is a group interview, and it's kind of, it sounds intimidating because we kind of gang up on you. That's actually how most hospitals are hiring now. If you apply for a job, they're gonna have like 3 or 4 supervisors, a director, and other staff, and they're gonna ask you questions like why you want to work there. And it's kind of like, okay, they're all ganging up on me. So we try to simulate the same thing as the job. And what we do is we get an instructor from Respiratory, we get a director from a hospital, and we ask you questions like why you want to get into Respiratory. And if you say, because I love to breathe, I'm gonna be like, okay, don't you have to breathe? So you cannot say like things like, for example, I want to buy a Corvette and I heard you guys have good money, so I decided to go into Respiratory, things like that. So talking about Corvettes, do you guys want to know how much we make? That's good to know, right? I mean, that will make a decision whether to go into a program or not. With no experience, full-time with benefits, you're starting about 24, 25 here in the Valley. And with the experience, with 1 year experience, with no benefit that's needed, PRN, they start at 33 to 35 an hour. I worked at Mission Hospital as a supervisor, and Mission Hospital had something called Star Shift, where they would pay, like if you were not in the schedule, they will give you $10 more if you come into work. They call it volunteer, but it's not really volunteering because they're paying you. But if you show up to work, they give you $10 more. So a lot of people were on overtime, and they were like $33 an hour. So they were getting paid $10 plus the time and a half, and they were making, well, if they showed up, they were making about $60 an hour. I would call about 40 people, and I mean, it's amazing, but a lot of them would say, you know what, I want to go to work, but I promised my kid I'm going to go take him to see Transformers, the movies. And I'm like, seriously? Like, can you take him another day? We need your help. And they had to make that decision. And that's why my students would say those are problems of rich people, because if you go and work for 1 day, 12 hours, you're going to be taking home about $600 just that day for 12 hours. So that can be the difference of going to South Padre Island and going to, Vegas or something else. I'm just saying, for a girl, what can you do with 600? Maybe a Louis Vuitton, I don't know how those run. And for a guy, maybe a PlayStation, I don't know, maybe something else, I don't know. It's not enough for a car, right? But then you have other selections. The schedules in the hospital, we normally work 12 hours, so we go in at 6 in the morning and we get out at 6 p.m. If you work nights, you're going to go at 6 p.m., get out at 6 in the morning. That's kind of like the schedule. Any questions? I know I'm talking a lot. Everybody's awake? In this program, you're expected to think, use logic, and you're also going to use your critical skills to evaluate. I kind of mentioned before that it's not a memorizing. You cannot memorize the information, you have to learn the information, because it's going to come back and haunt you. And I brought students so they can tell you about their experiences. And one of the things that I just wanted to mention is that we represent a profession, so we have to be professionals. And a lot of times we demonstrate behavior by facial expressions. So like if I'm here, like for example, if I'm supposed to be in class teaching, and I'm here and taking my time to come over here and talk to you about respiratory, if somebody's kind of like falling asleep, that's kind of disrespectful, right? And that's kind of, I'm not saying that it's happening. I'm just giving you scenarios. So, these are some of the things that we expect from our students, like to be punctual, to have pride in what they do, to have mature actions, they have to dress professionally. They use the black scrubs and things like that. One of the things that we expect our students is the attendance. We have an attendance policy. If you miss 3 days in a semester, that's a lot of information that you missed, and chances are that you're not gonna pass. So what we do is we sit down with you and we give you a warning, and we say that if you're absent again, you might be dropped from that class. Now, if you're dropped from a class or for the program, you have to wait a whole year to take those classes again, because we don't offer, those classes, that time. So it's it could be very stressful for the students, because in a regular class you can be absent a day before an exam and decide to cram everything, that day and then do good on the exam. But for our students, they cannot have that luxury, because if they take several absences and then they have an emergency, that's our rules. I had a situation where a student, he was stuck in the expressway, and he's like, it's gonna take a while because they're gonna tow my vehicle. I have to get the tires or things like that. And I go, okay. And he was like, sir, you don't understand. And I'm like, what do you mean? He goes, this is gonna be my 4th absence. I'll be out of the program. And I'm like, oh, I understand. I go, we have the rules, but you have to take care of things. So he got his wife to go pick him up, and he made it to class, and he showed up in class because he wanted, that shows his dedication. But if he didn't have the other absences, he hadn't taken those other absences, he could have been absent that time. And it's not that we're mean, it's just that in clinicals we do 12 hours. If you miss one day, that's 12 hours that you miss on competencies. Even if you miss one day, that might make the difference between an A or a B, because you're not gonna be able to do those competencies again. It's not like you can go on a Saturday on your own and do those competencies. So, any questions? So I already talked about this. Clinical sites and schedules, I mentioned it. We do visit all the hospitals in the area, so we go to Mission Hospital, McAllen Medical, Regional Heart, Edinburgh Children, Edinburgh regular, DHR, and Westlaco. And we do go to doctor's offices, Lee's Pharmacy for DMEs, sleep studies, and other specialty rotations. The hours for the students, they go in at 5:45 in the morning. That's when they have to be there. We start at 5:45, so they have to be there at that time. And they usually do 8 hours during the long semesters, and in the summers we do 12 hours. So it's kind of nice when I mention, that they're in the hospital, but imagine if you have to be in the hospital at 5:45 tomorrow morning. At what time do you guys have to get up for that? Are you gonna get up at 5 and be there at 5:45?
No.
So it's, and then you cannot be like The Walking Dead either, in the hospital. You're gonna be going around and doing treatments and going to code blues and things like that. So the next thing was the pig lung demonstration.